Welcome to the Gold Coast Plastic Surgery Podcast. I'm Dr. Mark Doyle. I'm a specialist plastic surgeon and I've been working in the industry for more than 30 years. It's my privilege today to introduce Alexandra from Laser Skin Centre.
Are you wondering if a brow lift will minimise forehead lines? Luckily today I've got Dr. Mark Doyle, specialist plastic surgeon of 30 years with me. Dr. Doyle, how does it work?
The answer, Ali, is yes. It can tighten the skin of the brow and it can also improve forehead lines. But as always, every person's different, and therefore the results change from one person to another.
Of course. And who would you say is a great client for this? Is there a suitable candidate, somebody more so than others?
Yes. When I see somebody looking for a brow lift, the things to look at, number one, fairly obviously, is the position of the brow, because as the brow goes up or down, it makes a difference to what's required in order to change the effect. If the brows are low, that means that the skin of the upper eyelid gets more accentuated because the brow's pushing down on it. If you lift the brow up, the more the brows lift up, the less it looks like there is less skin on the upper eyelid. So that changes. I can tell if people have problems with their brows when I look at them, because what happens is people that have got brows that are low, as the skin comes down on the upper eyelid, they have trouble seeing. So subconsciously what they do is lift their brows up. So when I come in, you'll see these horizontal lines, and that's because they're not doing that on purpose, but it happens because they want to be able to see. So in those cases, lifting the brows up into a better position, what will happen is once the brow's up there and sitting in the right spot, then there's no need for those muscles to work anymore. Therefore, you get less horizontal lines on the forehead and the skin tightens up.
So with this brow lift, what are the techniques? Is there something that you do more often than not with this type of procedure? Can you walk me through it?
Absolutely. The commonest procedure I would do is an endoscopic brow lift, and that's done by making either 2 or 4 incisions inside the hair, so there's no scars on the forehead. I use an endoscope, which is a type of telescope that goes underneath the skin and down to the area where the brows are. The operation's done in a couple of ways. The standard way that I would do this is using a small telescope, and the reason I do that is the scars are a lot less. So 2 small cuts in the hair on either side. Telescope goes down, releases the brow on the inside, allows me to pull the brow up into the position I want. I can then, from using that so that I can see from the inside, I can disconnect the brow and then move it up as high as I want to. Once it's in the position I want, then I use 2 little screws in the hair that go into the scalp, and they hold that in position. Those screws stay in. They stick out through the surface of the skin by 2 or 3 millimetres, and they stay in place for about a week to 14 days when people come back to the office and remove the screws. I use that procedure because the scars are in the hair and they're therefore not visible scars. The other techniques which I very rarely use is it is possible to lift the brow by making a cut in front of the hair all the way across and then lifting the brow up and just removing some skin here. The potential problem with that is if you have some problems with the scar can be obvious, and it's possible you can lose a bit of hair in that area, again, which makes the scars more visible. If the other alternative, which was one done many years ago, and some people still do it, but I do not, is the scar that runs from one ear across the hair to the other side. And again, you can lift the brow up doing that. The problem is that with that is you have a very long scar all the way across the top of the scalp. All the skin behind that scar goes numb because the nerves are cut, and it's possible to lose a lot of hair in that area as well, so you end up with a scar that's really obvious because of the loss of hair and numbness on the skull. So again, that's not a procedure I'd recommend, but I still find some people do that procedure.
Alrighty, thank you so much. That was so informative. I didn't know that there were that many ways to do a brow lift. Yeah. So it sounds like that brow lift you can smooth, tighten, get a little bit of a firming there.
Yes.
And how can we reach you?
Well, just before we finish, one thing I wanted to say is that the brow lift will lift the loose skin of the upper eyelid. So it's like almost having a blepharoplasty in terms of as the brow goes up, so does the skin in the upper eyelid. I see a lot of people that come in and have upper blepharoplasties to have their skin out, and they don't have their brow adjusted. And sometimes the brow is a more important way of fixing loose skin in the upper eyelid than it is doing the blepharoplasty. And people that have had blepharoplasties in the past, if they come back and see me and they've got loose skin there again, it's not because the skin grows in the upper eyelid, it's because the brow has fallen down. So the correct procedure for somebody that's had a blepharoplasty before, now has loose skin again, they've gone back to where they started from, the first thing I'll be looking at is the brow. Because once the brow's in a better position, everything else just improves because of it.
And I suppose this is why you always need a consultation. You know, each individual is really different, and you will, of course, discuss all these concerns at that time of the appointment.
There is a lot of doctors that do upper blepharoplasties. There are not as many doctors that do brow lifts.
No.
And I have seen quite a few people come in where they've had so many blepharoplasties that they can't close their eyes, which is a really difficult thing to fix when they should have had a brow lift.
Okay. So as you've heard, you know, a consultation is definitely required, and you can contact myself by DM or, of course, direct www.goldcoastplasticsurgery.com.au or simply phone his inquiries team.
Thank you.